There are indications that relevant government agencies are winning the battle against the spread of Lassa fever, a seasonal infectious disease common between the months of November to April. Although there are still cases of infection, but it is not widespread, as authorities in the Irrua Specialist Teaching Hospital Lassa Fever Control Center say, compared to last year when 100 casualties were recorded, about 30 victims are receiving treatment brought in from Edo, Ebonyi and Ondo states, with only 5 deaths recorded since the outbreak last year, noting that report of death of medical personnel is false.
In terms of drug, ribavirin still remains the most effective antiviral drug that we use for Lassa fever. Of course, there are things, there are other drugs that we use, antibiotics. If we think the patient also has malaria, they are given anti-malarials. And any other comorbidity that the patient may have, like diabetes, mellitus, hypertension, all those are treated. A lot of supportive treatment also goes in for Lassa. For those who have renal failure, they have dialysis. Some may have to go 4, 5, 6 dialysis before the kidney picks up. When there's this fever that is not responding to your common anti-malarials and your antibiotics, physicians are advised, people are advised to then go for further testing to see whether it's Lassa fever virus. And like we know, there are many centers in the country now where the Lassa fever test can be done. And I think any of the centers can do the test and then appropriate treatment can take up from there.
The director of the center, Ephraim Ogbani, is emphatic that the rigorous awareness campaign and the federal government's prompt response through the Nigerian Center for Disease Control is paying off. In Irrua Specialist Teaching Hospital, Irrua, Agatha Egwaruju, NTA News.